many women in here practices self-care? Okay, for the ones who does not know, self-care is the action of maintaining your health mentally and physically. Every woman in here needs to know the importance of keeping yourself healthy, especially because of the major increase of women who suffer from anxiety and depression. As a woman who practices self-care, I understand the societal pressure that pressures us to focus on our outside appearance, such as our clothing, hair, and nails, rather than our inner appearance. The purpose of this speech is to discuss counseling, prevention, and outcomes. First, let's talk about counseling. What is counseling and how does counseling relate to self-care? Counseling is professional help where you talk about your life by expressing yourself or to help get over certain things. There are millions of women who suffer from endometriosis, who goes to counseling for this specific condition. Endometriosis is a painful condition where the tissue like the uterus lining grows outside the womb. According to Crochet and others, endometriosis can have effect on the mind, the body, and quality of life. Also, according to their clinical trial, where they had two groups, a control group who did nothing, and an experimental group of women, who went to counseling intervention 7 days out the week. The women who went to the counseling intervention 7 days out the week had the smaller rate of anxiety and depression at the end of their clinical trial. Next, prevention. What is prevention? Prevention is the actions of stopping something from happening. How do you prevent certain health complications such as preeclampsia? Preeclampsia is a pregnancy complication caused by high blood pressure and or kidney damage. According to Rattler and others, there are many ways to prevent and control preeclampsia, such as counseling and screening, which can include measuring blood pressure, checking for signs of depression, and checking for history of preeclampsia. Other ways to prevent preeclampsia before pregnancy and during pregnancy is changing your lifestyles, such as learning to manage stress, dieting, and exercise or other physical activities. Lastly, outcomes, which is the results of something, where in this case, the results of practicing self-care. According to Jackson and others, research findings indicate that awareness and resilience do predict self-care, and self-care meditates the negative relationship between stress and health. This suggests that the role of stress on Black women can be reduced by implementation of awareness and resilience. In conclusion, I just discussed the importance of self-care in many ways to practice self-care, including counseling, prevention, and outcomes. I also discussed many more ways to help better and maintain your mental health, physically and mentally. Now that you have some knowledge of self-care, do you think there are some practices that you are willing to try or start? I'm Rattler. Thank you for listening.